Our incredible oncology nurses and APPs really play a critical role in all that we do. And I think especially in our roadmap, after speaking with so many incredible, oncology nurses and APPs, as we developed this guide, I think one of the main things is that the APPs and oncology nurses, they really are our bridge to understand what our patients are experiencing because they're the front lines and they get to have such meaningful conversations with patients, whether it's in the infusion clinic or as they're going for their appointments or meeting with them to discuss, all sorts of situations or side effects that they may be having. So we can learn so much from our wonderful professionals, and we have and will continue to work together. But I think, again, it's that they're on the front lines, and over again, our patients always say to us, if it wasn't for my oncology nurse, I wouldn't have gotten through this. Or if it wasn't for my APP really taking me under their wing, I don't know if I could have gotten through treatment or surgery or radiation or whatever that might be. So I do think that a clear, um, you know, main stakeholder are our oncology nurses and APPs. Again, the front line, and our patients rely so heavily and form these wonderful attachments that go well beyond after they finish treatment. So many of our patient and survivor community come to us and say, I still have a relationship. I still touch base. And every time I go in for a checkup, I always ask if, my wonderful nurse is there, etc. So again, such a wonderful relationship, and we rely heavily on them for their guidance and their understanding of really the patient lived experience. I think like no other, to be honest with you. I think they really hold so much wonderful information, and the care they provide is second to none. One of our main call to action items in creating the multi-stakeholder, partnerships is for that to continue to grow, because we know that across the United States, there are so many individuals and, healthcare systems and community health centers, et cetera, that may not know about our GI Cancers Alliance and may not know of the work we're doing. And so we just want to continue to reach out to those organizations, to those patients, and again, let them know they're not alone. Let them know we're all in this together and that they have a voice. They have a seat at the table to make their voice known and to give us their ideas and their opinions and share their stories of what they're going through, because we can learn from absolutely everybody. And again, we know no two journeys are the same. And so for each patient, each healthcare professional, advocacy groups, industry, our wonderful media contacts, we're working together, we can be that bridge and we can continue to move forward. I think that is our main call to action, is to just keep the momentum going. And again, we welcome ideas and for you to share your information, for you to share your successes and failures, because we all learn and nothing is a failure. If something doesn't go as perfectly as we want, that's a learning opportunity, and we've all been there. And so maybe that just takes our collective work together to make a campaign bigger and more united. So again, we just welcome all opinions and patient stories, and just for everyone to know that we will continue this work, and through everyone's efforts together, we will help our GI cancer patient community and continue to grow so that no one feels they're going through this alone.